Yesterday I presented the results of the ERMES trial. ERMES is a phase 3 trial investigating the efficacy of the maintenance therapy with cetuximab alone after induction with FOLFIRI plus cetuximab in the RAS and BRAF wild-type metastatic colorectal cancer patients. The ERMES trial is a phase 3 trial, the first phase 3 trial in a setting where we had controversial results from 3 phase 2 trials, such as the Valentino trial, the Panama trial, and then the Macro 2 trial. So we have, for the first time, a phase 3 trial in this setting. For ERMES trial, we had 2 co-primary endpoints. The first one was the non-inferiority in terms of progression-free survival of the experimental arm versus the standard arm. The experimental arm was cetuximab in maintenance with alone therapy, and the standard arm was FOLFIRI plus cetuximab until disease progression. The second co-primary endpoint was a better profile of safety in terms of lower incidence of grade 3 or 4 adverse events for experimental arm than a standard arm. So, with the ERMES trial did not meet the first primary endpoint, but we have some interesting results we can bring in our clinical practice. In fact, for the escalation arm with cetuximab alone, the experimental arm achieves an interesting performance in median progression-free survival with 10 months in median progression-free survival. And these results, it's quite similar with other studies with more intensive treatment in this setting. At the same time, we don't observe any difference in overall response rate between the 2 arms, and more interesting in overall survival results, the experimental arms achieves a median overall survival of over 30 months. And also the results were consistent with other phase 3 trials in this setting with more intensive therapy, such as the doublet or triplet plus anti-EGFR. So, despite the negative primary endpoint, the ERMES could allow to preserve the hypothesis that we can ultra-select in the RAS and the wild-type population some patients that can benefit from these de-escalation strategies, and that ultra-selection could be made possible with the use of NGS in the tissue sample and liquid biopsy. And the NGS analysis on tissue sample liquid biopsy are ongoing in our study, and we'll hope to present these results in our next meeting.